Okay, you guys, today the podcast is one that is going to be. Here's the thing, it's so informational and it's so much fun. I have my new friend who's quickly become a really good friend, Dr. Radhika Sharma, who is an OB-GYN that specializes in women's hormones. So, in this episode, I'm actually pulling an appearance she did inside of one of my communities where we are talking about everything that we as women feel is off limits to asking anyone as we age. We're going through premenopause, menopause, postmenopause. There's so many things happening in our bodies with these hormonal shifts. We're experiencing dryness, we're experiencing odor, we're experiencing all of these things, and this is the place. This is a big Q&A. No names are attached to any of the questions that are asked, but you are going to hear anonymous questions from women just like you, wondering what the heck is going on with my body as these hormones are shifting. What can I do? Is it normal? And what can I do about it? Truly, if there is a question that you don't even want to ask your mom, you're so embarrassed about, this is the place to come and listen and hear what Dr. Sharma has to say. Enjoy. Okay, let's get into it. Radhika Sharma is a dedicated OB-GYN certified wellness coach and co-host of the Double Scrub podcast, passionate about women's health, workplace wellness, and preventing burnout. She has spoken at numerous events and podcasts, delivering engaging, relatable, and thought-provoking talks that inspire action. She's co-author of Thriving After Burnout. I feel like I need this book. And has been featured in Fabulous Wisconsin for her expertise and health and wellness, with a special interest in nutrition, lifespan health, and overall well-being. Is she not the perfect guest? She empowers individuals of all ages to take charge of their health and find balance in their personal and professional lives. Known for her authentic storytelling and ability to connect, I can attest for this, with audiences, she brings both medical expertise and real-world experience to every stage she steps on, whether discussing burnout recovery, wellness strategies, or the power of self-care. She leaves audiences feeling motivated, informed, and ready to take the next step. Ladies and possibly gentlemen, we don't know. Please meet my new friend and our special guest today, Dr. Radhika Sharma. Okay, wait, you're muted. Yay! There you are.
I was trying to mute myself at the same time.
I am so happy to have you here.
Thank you so much. I'm so excited to be here with you and your community. It's just such a pleasure.
I think this is I mean, no offense if any other past guests are listening. You are the guest I am the most excited to have on here because this is like, I feel like this is something that like I want and I
Yeah.
need, you know? So
Mhm.
I'm very excited. Okay, what did I leave out? Tell us a little bit about you before I dive into me and us.
So, yeah, I mean, OB-GYN you mentioned, I've authored, I've spoken, but more importantly, I'm going through this too. I started going through a lot of these perimenopausal changes myself in the last couple years. And so as an OB-GYN, I was like, I need to like figure this out for myself so I can thrive. And then like most physicians and doctors and nurses, as we start going through this, like these are the patients that kind of age with us
Yes.
and they start having the same things. And I'm like, I am not going to just like suffer. I'm sorry, I'm not going to do it. And, I look at women in my family who are older, who are going through things like, I'm just aging and like, oh, it's okay. And that wasn't enough for me. That answer wasn't okay. And then I look at some of just like the, amazing women that I see at the gym in their 60s and 70s. And I'm like, I want to be that woman. And it can't just be like their genes. It can't just be just because. And so, I went through my own trials and tribulations between work, having children, marriage, friendships, all of it. And I was like, I need to fix this and I need to figure this out for myself so I can empower my patients, my friends, my community, and others. And so that's
I
where
love
this
that.
all started.
So I had started to on the phone the other day. We had a conversation over Zoom and the phone a few different times
Mhm.
because
Mhm.
mostly I was rescheduling, right?
Listen, like mom life, truth.
It
Your
really was
group, I'm
all
sure, is like mom life and human life and just
overlooking.
all.
There were just so many things, you know? But
Always.
one of the things I was telling you one of the days, I said, "Oh my gosh," because we started talking. I said, "I feel like I need to tell you, but I'll wait for the live."
Yeah.
My experience with
Mhm.
an OB-GYN.
Yeah, and I remember being like, "Oh dear, I can't wait."
It was okay, so we'll get more into the details of this because let me just say I have always had maybe we'll just go there now. I've always had a healthy functioning female body, right? I've
Sure.
always had everything's work has always worked, right? There's like
Yeah.
the moisture where it needs to be. There's everything. There's
Yeah.
like a sex drive. There's
Yeah.
and all of these things completely shifted for me a couple years ago. And I was like, what the actual heck is happening? Okay. So
Mhm.
I'm dealing with bacterial infections coming on all the time. I'm like, what is going I'm having UTIs like crazy. Like
Mhm.
it's like the Sahara Desert, like gone overnight. I don't
And
even
you're like, "This never used to happen. I was fine."
I can't even it was the hardest, most embarrassing sexual thing for me to go through. And I
Yeah.
remember with my partner, I was like, like, I swear I'm not normally like this. And then I'm like, he's gonna think it's him. It's all this stuff going through my mind, right? And I'm having to like use lubricant for the first time. Like it just is like, what the heck is happening? And then every time I had sex, I was getting an infection. Every like something was happening.
Yep.
No STD, we're testing all this stuff. And finally, a friend of mine is like, I think it's just well, no, I had not talked to the friend yet. I go to my doctor
Yeah.
and she just keeps giving me antibiotics every month. I'm on a new antibiotic every
Mm.
month,
Mhm.
which just wrecks my gut. Whole
Mhm.
like all the good bacteria is out, which means good bacteria from the the lady parts down there, right?
Mhm.
And I finally got to my doctor and I said, "Hey, I feel like if I do another antibiotic, like I don't know, this is not feeling good for me. What is
Yeah.
happening to me? Like I am all I list the symptoms again." And she was like,
Yeah.
"Well, welcome to getting old. This is just how it is." That's what she said to me. Now, it was not my normal OB-GYN. It was a
Sure.
network of doctors there. And
Sure.
I remember calling back as I was scheduling for the next time. Alexa remembers this. And I was like, I can never see this doctor again. She made me feel like my life was but in my mind, I'm like, I was so depressed. It
Yeah.
actually put me into an anxious, depressed spiral
Yeah.
that made me feel like I'm just doomed. Why didn't anyone tell me about this? Like, why didn't I know I'm having hot flashes? Little did I know I was taking a supplement, DIM, that was kind of putting me
Yeah.
into early menopause, right?
Mhm.
So
Mhm.
all of this stuff was happening in my body. And I was told, this is just how it is. Welcome to getting old. And so I left after I was sad. I actually really did cry. I called my mom, who was like, I don't know what to tell you. You know, she had no idea what to say. Your mom doesn't have the answers. And so
Mhm.
I went on a quest. I was like, who are women in their 40s who are thriving and saying, I'm better than ever. And so I
Yeah.
called a couple people who were like, "No, you're seeing the wrong doctor. There's like
Yeah.
the right ones will help you find solutions because sexually and all of the ways, like
Mhm.
you can actually get better. You can actually be normal. You can actually feel younger." And
Mhm.
so when you and I our paths crossed and we were put in contact, I was like, "This is just the greatest," because I want everyone here to I see these questions and I'm like, I had the same ones.
Yeah.
And so just thank you for being here.
And I will tell you, let me like caveat that what you're saying, I literally was in clinic this morning and I saw 3 women and like in my cohort who were like, I just thought I was going crazy. I thought there was
Yeah,
something wrong with me. And I thought like the depression, the anxiety, the fears, they're real and they
yeah,
affect and then they affect everything. So I'm
they
really glad we're doing this.
yeah, it would like I mean, now we're just but mine would even go to I would like start to notice hair loss or hair thinning, like
Oh yeah.
just would spiral. Like I realized I have an insane, no, not insane, that sounds bad, but an intense rumination reaction when
Mhm.
I start to feel like um when I start to recognize my mortality. That's what it is.
Oh,
And
yeah, the lifespan health span debate. I mean,
yeah, yeah,
it's huge and it's scary.
it's really scary. Yeah, and this like the I maybe I mentioned this to you, but going through menopause for me, or like this pre-menopause period, whatever I'm inside of right now, which
Mhm.
by the way, let me just tell everybody, I am in a drastically different place. I have since found amazing doctors. I have found people that give
Yeah.
me hope, and I feel normal. Like I feel better than ever at 43 after a literal dry spell. Like I went through
Yeah.
a dry
And a
spell.
discovery, right? Like
Yes.
advocating for yourself, finding your people, finding who you needed.
Your team, yeah. Um, but yeah, I think for going through these hormonal shifts, do you remember when you started your period like years ago?
Oh, yeah. It was horrific. It was
Yeah,
horrific.
what was it like for you?
Well, I was at my aunt's house. I wasn't even at home. And pretty much like without being TMI, but TMI, because why not? I literally like started bleeding through my clothes. And I
Oh,
thought I was like, I thought I was dying. It was awful. I
oh,
sat in the bathroom and it was the summer and I'm just crying. And I remember leading up to it, starting to have those anxiety feelings. And then obviously, like when it started happening, I was like, oh my gosh, how long is this gonna happen for? Like, is this every month forever? Am I like gonna lose control? And I just remember like being a shadow of myself and not wanting to talk to my family or my friends, like wanting to lock myself up in the room for a week. And then like I was in that generation where a lot of people who were like, yeah, it just happens. And I specifically remember walking through the mall with my family one day and like pretty much laying on a bench in the mall because I was cramping so hard. And they were like, it's fine, just walk it off, take some Tylenol. I was like, I'm gonna die. Like, this is awful. So,
oh, that's
yeah.
I remember feeling very similar thoughts and feelings. And it's this idea, like for me, there was this like I knew what was happening. I knew like
Yeah.
for it. They kind of you get your period kit or whatever it is, and you have
Yeah.
your mom's like, here's the tampons. Still not really talked about, but like didn't matter what anyone said. I felt broken.
Mhm.
I
Like
completely
there's
because
something
all
wrong.
I knew was life with not having a period, and suddenly I'm bleeding, and I was so embarrassed. There was like this embarrassment that I had reached a level of development that like I was unfamiliar familiar with. Like I didn't like it. I hated it. It took me a while to get used to it.
And nobody really like, especially like if we're in our early mid 40s, nobody wants to talk about it because you don't talk about like periods and the feelings surrounding it and the changes in your body because it was shunned. Like it was 20, 25 years ago, it was shunned. And even now in some circles, it's still shunned, you know?
I know, which is great that we're here because like
Yeah.
I had the same experience maybe about a month ago, 2 months ago. I was
Mhm.
driving and I was getting news back about my FSH levels, my follicular stimulating hormone levels were like high. And the
Mhm.
higher your FSH is, I think it was like 29. It was high.
Mhm. Yeah.
And my doctor had explained to me, hey, what the not doctor, this was someone else who had done blood work, who
Yeah.
didn't know the rest of my system, who didn't
Yeah.
understand what I was taking, but had said, oh, your estrogen's at 80, your testosterone's at 10, right? Your free testosterone is 0.01.
Like
Like and
non-existent.
your FSH, yeah, your FSH is 29. You're like about to go through menopause.
Mhm.
And I
Mhm.
was like, I had this like,
Panic attack. I would have panicked.
oh, I
If,
got
especially if you didn't know, right?
yeah, I started, I was like crying. And I actually was trying to explain to a friend, I said, this feels to me the exact same way that
Mhm.
it felt when I was 15 and I
Mhm.
started my period. And I was embarrassed to be at the next level. I had full on embarrassment in that moment for being what I was told was menopausal. Now, I since know I'm not. It was certain things I was taking was impact, but who knows? I'll do it again. We'll see. But
Mhm.
it's so embarrassing. It was like, gosh, this just isn't like when I'm not fertile or I'm not young anymore. I'm not like, what kind of a life is that? All of these thoughts come through my mind. And so really, I loved when we started getting this challenge together. And I was like, okay, how can we thrive as we
Yeah.
age? What things can we do? What questions do we want answered? And I'm excited to dive in. There's a lot
Yeah, let's do
today.
it. And I mean, I think the big thing is you said something so important. There is this shame that we have.
And why? Why is
Like,
that?
where did it, and I think part of it is because historically, our like the generation of women before us, like our moms, our grandmothers, The answer was, "You're just getting old, you're just drying up." We didn't really have the knowledge. Like, literally, we were like, "Hey, when you aren't able to reproduce anymore, you're sort of like donezo, like, you're on
Yeah.
this downward spiral." And what's crazy is, like, there's women on average spend 40% of their life in menopause, right? Like,
Amazing.
that's a lot of living, and what we were just saying is like, well, you're done, your periods are done, you're done having babies, your estrogen's done, your sex life is done, your skin is getting saggy, your body's getting saggy, you're putting on weight. That's just and, like, that was an accepted thing. So we were all just like, okay, and it's so of course there's shame around that because as a woman, so much of who we were, so much of our livelihood was based around this idea of like, we're here to like have children and raise them and forget
Yeah.
us.
Yeah.
Yeah.
I
So
mean, I never even thought that through. 40% of our life is
40%. Yeah. Because
what?
the average age of menopause is 52. But guys, that's the average.
Okay, so the
That
average is 52.
average age is 52. That means that's your 50th percentile. That means there's 50% of the women, right? Overall, that's your average. And that's huge. And so like the other thing is like we used to say, oh, menopause, right? That's it. Now we learned like perimenopause is like 10 years, up to
Yeah.
10 years having
Yeah.
perimenopause before you stop having a period. So
Wow.
like when someone says to me at like 38, I feel like I'm starting perimenopausal symptoms. Yeah, you probably are. You very well.
Wow. Well, interestingly, my very best friend from elementary school,
Yeah.
my first best friend, she went through full on menopause in
Yeah.
her 30s. Got like
Yeah.
she's 42 because she's a
Yeah.
little bit younger than me. She's has no I and it wasn't because of a procedure or anything like that.
No, because
She's like,
it's
yeah,
and that's called premature menopause. And that happens. There's like a percentage of women, it's about 15% of women who will go through premature menopause. And what's crazy is when it happens,
can that happen?
say again.
How early can that happen?
So it can happen in like young women. So there are people who are born not knowing and won't get their period. And at the age of 15 or 16 are not having a period. And we do the workup and we realize they've had what's called premature ovarian failure. So they may never have children. Right? Or like even if you think about there was like a big Oprah special recently that I'm sure a lot of
Right.
people listen to where like Naomi Watts was like she didn't realize she had premature ovarian failure in her late 30s when she was trying to have kids. And so if you don't talk to the right people, like a lot of OB-GYNs can do the workup, but like what do we do
Yeah.
about it? Your friend at 30, you said she was 35.
She
She
was probably 38 when she went through menopause.
Yeah, she
Like,
probably
done.
she may not have been told, like, you actually those people, like, those individuals, they need to be on hormones
Wow.
to improve, many other things in their life, including, like, their overall lifespan.
Yeah. Yeah,
So
so she actually immediately, when she knew something was going on, she does the testosterone pellets and
yeah.
whatever for estrogen. So she just has her every 3-month appointment, and she said,
Yeah.
"I she feels phenomenal." She was like, she was a she's just an incredible athlete, even in her 40s, and had 4 kids, and just she's amazing. But like
Yeah.
to see her go through that, she was such a guidepost for me. Like,
Yeah.
see her go through that and to be thriving on the other side of it, I was like, "Okay,
Sure.
wait, this isn't the end of my life." In fact, I
No.
saw there were a couple as we were talking about how much of our life we spend in menopause. A
Yeah.
couple people were, Mandy said depressing. And so that's kind of the automatic thought, right? It's like, oh, this is depressing. But
Doesn't have to be. Doesn't have
yes,
to be, I
yes,
promise.
speak to this.
Yeah, so it doesn't have to be. So depressing, but at the same time, we're learning that we can do things to make women thrive in menopause and perimenopause. So, right now, the Menopause Society basically says when you hit menopause, within 5 years, if we can start women who are comfortable and who are good candidates, starting them on hormone replacement can be beneficial on multiple factors. It can be beneficial on bone health, it can be beneficial on heart health. We're learning that if women are started on estrogen earlier, it decreases their risk of overall dementia because women suffer from dementia at an 8 times higher level than men. Let that sit in there. 8 times higher. And we're learning that estrogen and things even like weight training can improve your overall health and reduce your risk of dementia. And I'm telling you, like, The studies that are going to come out in the next 2 to 3 years are going to be mind blowing on the importance of estrogen in decreasing dementia, cognitive decline, et cetera, et cetera. So, yes, depressing, but at the same time, like getting with the right people, getting with the right doctors. I just spoke with a neurologist last week and we were talking about like how we need to combine forces because there's such a large number of women who could utilize and gain from information on estrogen and hormone replacement. Having said that, I wouldn't be surprised right now. They're saying hormone replacement therapy is only safe in women who are postmenopausal, but you're going to find a lot of practitioners who are saying, actually, we can, like, if we know where you're at, as you said, with like your FSH, your LH, if we know where you're at, there are safe alternatives, not a combined birth control pill, which I know that was one of the questions,
Yeah.
that estrogen and progesterone replacement for women in perimenopause to help combat these symptoms.
Well, yeah, it's interesting because the doctors who I feel like in my experience, there have been
Yeah.
doctors who are taught what they're taught, and that's all that they know, right? In
Mhm.
school. Then
Yeah.
there are doctors that I have or have talked to who have really like dived in and done their research
Mhm.
and expanded. And obviously you fall into that
And
category.
will continue and will continue.
Yeah. Yeah. Because is it just that you're not taught this in med school? Are you not
So,
taught, so then you have to learn on your, how do we
yeah,
get
it's
this whole
funny
group?
because
Find your team. But how do we do this?
yeah, because my husband and I were just talking about this. We did a podcast on this recently, and it was like in you can I don't want to fault anyone's
Yeah.
OB-GYN. I am not going to fault anyone's
Except for
family practice
mine. Just kidding.
doctor
I'm kidding.
only
She's
because of what
not.
they said to you. But I will tell you, like, even in the community I live in, I have women come and tell me, like, I love my obstetrician. She delivered all of my babies and she took care of all of my birth control. But I called to ask her about hormones, and the office literally said she doesn't do that. Can you imagine calling an office where this has been your provider for the better part of 20 years, and now all of a sudden, like, you love this person, but they won't take care of you? And here's what I'm saying, like, we do 4 years of medical school. All docs do 4 years of medical school, and then
Okay.
we go off into specialty training. So my specialty training was OB-GYN, obstetrics and gynecology, so delivering
Okay.
babies and gynecologic service. That's
Okay.
a 4-year residency. So we don't a lot of people think obstetricians are just delivering babies. We're doing all of it, right? We're doing the surgery, we're doing the office, we're doing the deliveries. So we have a huge amount to cover. We cover perimenopause and menopause probably no more than 2 months out of 4 years. Let that
Wow.
sink in. We
Wow.
literally
60
have
days.
such little knowledge. And
Wow.
unless as an OB-GYN or a family practice doctor, you actively go to learn more, it's nobody's fault. This is the way the training is built. And so we don't know what we don't know because we aren't taught it. So unless you go out and say, I want to know about menopause, I want to know about obesity medicine, I want to know about vaginal estrogen and vaginal and sexual issues, like
Yes.
we cover like none of it. So unless that that's your interest,
Yeah.
you're not going to know about it.
This is really interesting to me because I know this. I know that in any
Sure.
trade, you're only as informed as you cause yourself to be, right? So you
Yeah.
have to any trainer, same.
Yeah.
But interestingly, I think we just automatically feel like every doctor knows what they're saying. And so it brings me back to that appointment where the doctor had told me, this is just what it is to get old. I remember actually now, this is first time I thought about this since I had asked, I said, what about hormone replacement therapy? Is what I
Mm.
had said. And she told me, but I believe this is, she just doesn't know. She had said,
Yeah.
yeah, you can do that, but it's really just a waste of money. They're just basically taking your money, is kind of what she said.
Sure.
And I believed her in that moment because it's like I'm used to taking what someone says who's,
It's
beyond
the
me.
doctor-patient relationship, right?
Yeah.
You wanna trust the person you're seeing. I
Yeah.
don't think there's anything wrong with you feeling like, "Well, yeah, of course she's telling me what's right," because in
Yeah.
her knowledge, she
Yeah.
is telling you what's
Yeah.
right. And
Yeah.
to be fair, depending on the age of your doctor, in 2001, the Women's Health Initiative ruined hormone replacement
Mhm.
for the next 20 plus years. And it's not only in the last 2 years it's coming to light being like, all of this was bogus. And like, we can't, so there's a generation of doctors who were taught that hormones are scary and bad and
You're
cause
gonna get
breast cancer.
cancer. Yes.
Oh, 100%. And like, and you're gonna have a heart attack and a stroke, and they're gonna kill you. Like,
Yeah.
that is an entire generation. That's 25 years of
Wow.
teaching that people, right? Because it's 2025. WHO was released in 2001, 24 years of knowledge that has been gapped. So if you're seeing a doctor who's in their 50s or 60s, that's what they were taught.
Yeah.
That's what they know.
Wow. Yeah. This is, well, a couple things. You had mentioned the thing about cancer and breast cancer, estrogen. I actually was just telling Alexa before because I use uh, an estrogen serum. It's like estriol or something
Yeah.
serum,
Mhm.
and it's a local, so it's a local
Yeah.
estrogen, and I do
Mhm.
it twice a week or whatever for whatever my doctor had said because
Yeah.
of the issues I was having, and it's great. It's been awesome. But I actually had recited to Alexa what I had heard. I said, "Yeah, I think taking estrogen or doing estrogen systemically will cause cancer." Is that accurate or no? Are we saying this is not accurate?
Oh,
Very
honey.
good.
This is why we're here, girl. This is why we're here. It is, I am going to come out and say it is an inaccurate statement. And
Okay,
here
so should I
is
be doing it?
why. Here's why.
I
Okay.
love this.
So the I shouldn't be laughing. I'm
No,
sorry.
this is so great. I
It's great.
love it.
So,
Laugh away.
okay, I'm gonna give it nice in like a nice synopsis. Okay, so the Women's Health Initiative study was the largest study performed and we got the results back in 2001. Science is not perfect. Data interpretation is not perfect. Uh, the scientific community in 2001 came out and said estrogen causes breast cancer. The
Yes.
women in the Women's Health Initiative study, most of those women were 60 years and over. Most
Mhm.
people have symptoms, as I said, between 38 and 5 years of the onset of menopause. So the women that they should have been looking at were 10 years younger than the women that they treated. So what they found is, oh, you give these people estrogen and progesterone and they get breast cancer. Yeah, they're not the people that you should have been like looking at. You should have been
Oh,
so what all of the information that we've been told is essentially wrong. If estrogen and progesterone are started safely
okay.
within the first 5 years of menopause, it is safe in a
Okay.
person by person basis. It is not wrong to say the combination of estrogen and progesterone, if it's started after the age of 60, may
Oh.
increase breast cancer a small amount. However,
What? That's it?
I think what the most important thing, this is how I akin it, right? You go skydiving. Are there
Yeah.
risks of skydiving?
Yeah.
Yes. Are there benefits of skydiving? Sure. Let's say we don't skydive.
Yeah, I don't like to
Let's
skydive.
say we're smoking a cigarette, which our community doesn't do that, right?
Yeah.
Or vaping or drinking.
Yes.
I did an
Yes.
entire podcast on drinking.
Yes. Yes.
For
We
those
could.
that drink alcohol, I'm not saying drinking alcohol is bad. I like
Yeah.
my glass of wine. There are risks and benefits of everything. Estrogen and
Yes.
progesterone are no different. There are no different.
You just blew my mind with this. I had no idea.
I tried.
Anyway, so now here's what I want to know.
Okay.
How do I know if I'm in the 5-year window
Yeah.
of when estrogen would need to be replaced?
So
When I
here's the
started.
thing. So what's really important is there's a lot of debate, and you won't necessarily find if you polled 10 hormone replacement providers,
Mhm.
five of them may say I absolutely check hormone levels, and five of them may say I absolutely don't. So
Mm.
here's the thing with hormone levels, and I have a beautiful chart, but essentially when we are before perimenopause, so let's say the average woman starts her cycle between 12 and 13,
Okay.
and then we say we have normal cycles till about 38, let's just say, okay? We know if you, the average, I don't say normal because I don't think there's anything
Okay.
as normal. The average person we will be able to see what your hormones are doing at a specific time in your cycle. So we
Okay.
know that this is what your FSH or your follicle stimulating hormone is doing. This
Yeah.
is what your LH is doing. This is what your estrogen is doing. This is what,
Yeah.
when you hit perimenopause, you are not ovulating, releasing the egg from your ovary regularly because all of those signals are doing this. Boop, 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 boop.
Oh,
So if we are checking those levels, they aren't necessarily reproducible from month to month because they're not the
okay.
same.
Okay.
So we actually should not be treating the hormone level in
Mm,
perimenopause unless it's above a certain threshold.
okay.
However, if someone's having symptoms, we know there is a safe way to manage them
Okay.
without checking hormone levels. So you don't have to check hormone
Okay.
levels.
Okay.
But I will say this, and someone said this to me about a year ago. Checking hormone, if a man went in and said, "Hey, I'm sorry if there are any men on this." Actually, I hope there are because my husband's an
Yeah.
OB-GYN
They
and
need to hear this.
he's always like, "Guys,
Yeah.
listen, this is actually
Yeah.
something you tune into." If a man went in and said, "Doc, I can't get an erection,"
Yeah.
and said, "I want my testosterone checked," the doctor's not going to blink. They're going to say, "Sure,
Yeah.
absolutely."
For
It is
sure.
your prerogative as a woman to
Yeah.
have your hormone levels checked.
Mm, oh,
Caveat to that is I will check your hormone levels and tell you, hey, look, we may not guide your treatment based on these hormone levels. These hormone levels may not tell us a lot, but
okay.
I've changed my stance. I used to be the doctor being like, no, 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 you don't have to check your hormone levels. And
Yeah.
now I'm like, if you want your hormone levels checked,
Get them checked.
check them. Fine.
Yeah.
We'll do that for you. That's okay.
Yeah.
Even if that means it may not guide our treatment plan, that's
Okay.
okay. Now,
Okay.
if someone is having testosterone replacement, I
Yeah.
will say the recommendation is that we follow testosterone levels for treatment because that's the one hormone that we
Yeah.
replace that we will say we actually need to
Yeah.
guide because you can undertreat or overtreat for testosterone.
Yeah. I actually started because my testosterone had been so low for so long.
Yeah. Yeah.
I actually started it about 6 weeks ago,
Yeah.
maybe a little less. And I've actually I I'm like an over checker of everything because I want
That's
to make
fine.
sure I'm okay. And I
Yeah.
because of how I checked it twice. I've checked it two different times in 6 weeks.
Okay.
And I recognize because I was doing the injections. I'm terrified of having testosterone too high because the
Totally.
DHT release, I don't want to lose my
Yeah.
hair.
Hair.
I don't want
Yeah.
my voice to change. All these
Yeah.
things, right?
And then you start growing hair in different parts of your body too,
Right,
right? That's the other
yeah.
thing,
I'm like, "Okay, am I getting acne?" I'm really trying to stay aware of the
which is
signs.
great.
Yeah, and it's funny because I think we won't even go to that, but one of the things it helped me switch, I'm like, "I'm not doing the injections. It's just
Mhm.
too up here and down here." So I actually just started a cream,
Yeah. I was
which
gonna say,
yeah, and I'm
and
scared of
it's not.
how if it's stuck in your system for 3 months, I don't want that.
And FDA approval, let's say this, FDA the Food and Drug Administration is fast to approve like everything for men. And the
Yeah.
reason it's harder for women is because all of the studies were treating women like tiny men for a long time. Like I know that's kind of mind blowing to people. Like we
Ah,
didn't test women. We just thought we just treated women as tiny men. That was ridiculous, like the most ridiculous thing ever.
yeah.
What a scientific failure. Women are small men. No,
Yeah,
obviously not.
yeah.
Obviously not. But
What if
having
we treated men like big women? What if we did
and
that?
I'm sorry for the man and this is not, like, I'm not man bashing at all. I'm man bashing the
That's
science
funny to think
behind it,
about,
okay? Because
it's like,
I have again, my husband's an OB-GYN, so I don't like, I just but I do get annoyed by the science. But my point is, yeah, like, with testosterone, it is not FDA approved. There is
Mhm.
no FDA approval for testosterone for women, but we know that testosterone can be advantageous. So the medicine is changing and expanding, and it's a beautiful thing because there's lots
Yeah,
of people who are
yeah,
interested in like how do we keep women healthy.
yeah. I'm just laughing as you're saying this. This all makes sense because, like I'm supposed to do point one on a syringe. Have you seen what point one is nothing, right? So it's like
Yeah,
nothing is
yeah,
compounded or made for a woman to make sure
yeah.
they're getting the right amount. And so you can double it without even realizing what you're doing.
And
It's
then
just,
even compounding, like compounding is so scary and There's some yes, that's a whole we could do a whole other
Yeah,
show.
we could. Okay. Okay, I love this. I'm gonna wrap up the hormone thing because I want
Yeah,
to get to vaginas in just a minute.
let's talk
Yeah, we're
vagina.
gonna go
What
there.
I do all day.
This is your specialty.
I love it.
We all have one, so this is
We all
great.
have one.
We
Well,
all go there.
mostly. Otherwise, I'm really glad you're
Yeah.
tuning in to learn about your woman's vagina.
That's
Appreciate you here.
exactly it. But for the hormones, there's a lot of people asking, like, how can I find a doctor who can test my hormones? Is this something you can do for them, or can you guide them to people? Like,
Yeah.
hey, hey,
So
hey,
I started a platform. I practice in the state of Wisconsin. I'm licensed in Utah and Nevada as well.
hey.
Even having said that, my husband and I are like, we're so sick of feeling like women are just not. They have nowhere to go, right? So I started what's called Save a Wellness, and it's a
How do I spell
platform.
SEVA?
SEVA, and we'll have the little QR code if you're interested in getting more
Okay,
information. But
okay.
essentially, it's a platform where I'm not trying to necessarily replace your doctor. If you're happy, you know what I mean? But it is a concierge platform where I can help guide you to find the person if you need to
Mm,
find someone in your area.
mm,
B, tell you like, hey, what can you do on your own? And C, help you advocate and empower yourself. Because
mhm.
this is like someone said, there are 40 million women who are needing these treatments and guidance, and there's 28,000 gynecologists, and not all of them do hormones. So just think about those numbers, right? So
Wow.
there's the Save a Wellness platform that I'm happy to help as many women and empower as many women as I can. Again, that's concierge
Okay,
practice. And
okay,
then the other way to do it is through the Menopause Society. So menopause.org, literally menopause.org, find
okay,
a provider. I think
okay.
the other thing is like women are like, I don't necessarily want to do this. Like, I don't want to have to go in to see someone. This is like can be a supplementation of your care, or you can change altogether.
Okay, this is awesome. So we'll make sure that everyone has this information. I love
Sure.
that. I didn't know exactly what people could do with you. So this is so
Yeah.
great.
Perfect.
Okay, should we talk about vaginas?
Let's do it.
Let's
And there
go.
was some so great stuff. A great day for vaginas yesterday. Yesterday was a big day for vaginas. Big.
Why, why was yesterday? Oh, because of all the questions or what? Was
That sure,
yesterday
yes, that
vagina
too.
day?
But the American Urological Association came out with guidelines for what's called the genitourinary syndrome of menopause, and it is so much about the questions that your group has. And I was like, woo, this is a big day.
Wow. Okay, this is so good to know. And is there
Yeah.
somewhere people can find this, or are we going to talk about this?
Yeah, we can talk about it.
Okay.
And there's so these are guidelines for physicians. So you can
Okay.
definitely like the nice thing is if you go to this website, you can read about them, you can learn about them.
Okay.
People are gonna have questions about them. So yes, please like refer back to me, refer to if you have questions to your doctors. But like this is for people like there's a question about a woman who's a breast cancer survivor.
Okay.
And this is for people who are like breast cancer survivors. This is for people who are
Okay.
like, I'm struggling with perimenopause now. This is someone in surgical menopause who we need to had your
Okay.
ovaries removed. And what we're saying is like vaginal estrogen should be like an over the counter prescription for
I
people.
agree with you. It's
I
been
feel like I say
broken.
it, I've said it so many times. I said it to my husband, I said it on the podcast.
Yeah.
I'm like, vaginal estrogen is
Yes.
equivalent to baby aspirin for heart health. I'm not even
Yeah.
kidding. Not even kidding.
I
Yeah.
okay. So tell me this. So this is going to go into topic number one. You already
Yeah.
know about my Sahara Desert experience, right? That's what I'm going to say. And I don't know. There was probably a lot of things that brought me back to normal. Probably,
Sure.
I don't know, because it was a whole full spectrum approach.
Sure.
But is the local estrogen, the vaginal estrogen, is that what is going to take people from dry to not? Because I there are so many questions.
Yeah.
Some anonymous saying, "I'm looking forward to hearing more about conquering menopause." Anonymous question: what do we do about vaginal dryness and several years of abstinence following divorce? She
Mhm.
she wants to be re-virginized.
I like that.
She is
Well, she thinks she is
yeah,
re-virginized. I
yeah,
promise you she's not. You're not broken. You're not
then
broken.
There's another person that says, "Is there a cream for dryness?" This is a big thing.
Yeah.
No one wants to ask this.
No.
Then another person says, "What do you suggest for vaginal dryness?" So all of this dryness, 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 we're all feeling it.
Yeah.
What do we do about it?
Yeah. So
Are you
yesterday, not
feeling it,
even
Alexa?
kidding.
Are you laughing? Yeah.
What did you say?
They said that means we're actually not feeling it. We're
Yeah, yeah, exactly, exactly. Right.
not
Well, I guess
feeling
we're not
anything
feeling
because
that's
nothing can
true.
get in
That's
there.
true. Yeah. So yesterday the American Urological Association came out with essentially the benefits of vaginal estrogen. And so I'm gonna start by saying like vaginal estrogen is king. And we used to think genital urinary syndrome of menopause was just vaginal dryness. It is not just vaginal dryness. It is vaginal irritation. It is frequent urinary tract infections. It is pain with intercourse, pain with penetration, pain after breastfeeding, postpartum, pain with intercourse after starting birth control pills. It is like you name it. It is such a fix-all. It is a beautiful thing. It is multi-formulary, meaning there was somebody who's like, I don't want to use the cream. It was messy. Cool. There's a ring. There's a three
I
month
have a serum. The
insertion.
serum's
There's a
great.
serum.
Yeah.
There's and then the other thing is like people are like, well, do you have to be on it for life? Do you take ibuprofen for life? Like, yeah,
Yeah.
yeah, it's okay. Like, you know what I mean? Yes,
Yeah.
and it's safe.
Yeah.
And it is so safe that we're finding now for women who are older, like it's preventing them from being in the hospital more for longer periods of time. It's keeping them alive longer. It's allowing them to have intercourse as long as listen, there's men who are
I
taking
think
Viagra. Why the
yeah.
heck?
They're
Like
taking Viagra at like 30.
yeah, to 70, 80. Like, you know what I mean? They're
We
taking it
shouldn't feel
forever. Like,
bad about this.
no,
Yeah.
we shouldn't. And it's totally normal. So vaginal estrogen is king. So people are going to say, well, I hear it causes breast cancer. The resounding data is that it does not. It
Okay.
is safe in breast cancer survivors. You can go to your medical oncologist and say, now I'm having like the newer medical oncologists who are cancer doctors who are
Yeah.
like, hey, can I prescribe it? I'm like, please prescribe it. Give
Yeah.
them quality of life back, right? Because after radiation, they have their vaginas are shrunk. The women who mentioned, hey, look, I haven't had sex in like a decade or whatever it was,
Uh,
vaginal estrogen, pelvic floor physical therapy. A lot of people are like, look, I don't want to go to pelvic floor physical therapy. I can't afford a pelvic floor physical therapist. Cool. Vaginal estrogen, silicone dilators used safely. Silicone dilators are $29.99 on Amazon for
fun.
multiple
Maybe
sizes.
I have one of these. What is this? I bought something for
Yeah,
muscles a long
so
time ago.
silicone is a very medical grade safe, meaning you can clean it really well. It's not like something that will get a bacteria on it, but if you use it in conjunction with vaginal
Run up
estrogen,
into my room real fast. I got to see if I have this.
but there's
It's getting
people
real.
who there's people who I will be like, "Hey, look, I want to have sex again,"
Yeah.
and it's like you use sequentially larger sizes of vaginal dilators to have sex again. Like it's doable. You're
Wow.
not broken.
Okay.
You're
Mhm.
fixable.
We're doing sheet changing day today.
Oh,
So
excellent.
hold
Well, it's
on. I have to
a fun
see
day.
if I have this. Wait, what is this? Someone got me this when I was telling him I wanted what that's
Oh,
a
I've heard
candle.
about this too. This is a pleasure system. So again, yeah, here's the thing. Why can't we talk about pleasure? Like, okay, I'm not
Okay.
gonna lie.
Let's
Like,
talk
if you don't have
about
the right partner or you don't have a partner and you want
this.
to have pleasure, as you should, as
This
you
is
should.
Kegel exercise system.
But that can also double as a pleasure system. Just so you
Okay.
know, when
Oh,
you learn how
really?
to do Kegels, someone asked about Benoit balls too. I saw that. That was
What is
very
it?
Benoit balls.
Okay.
Have you
What
heard
are
of Benoit
Venmo balls?
balls?
No,
So Benoit balls are like little silicone balls that often and silicones they can come as metal too.
like
Um,
this, kind of.
they're like
No?
that exactly, and
Okay.
they're usually introduced by a pelvic floor physical therapist because what it teaches you to do is it teaches you to engage the right muscles in your pelvic floor. Because when you're doing Kegels, we can all think like we're doing it right. Well, in order to do it right, you need to be able to hold the Benoit ball or that device up appropriately. And what it does is it lifts your pelvic floor.
Okay.
Used in conjunction with estrogen, not only can it can improve the caliber of your pelvic floor, but it's safe to use at home. The caveat to that is making sure you don't have another issue before, right? Having a
Okay.
proper vaginal exam. And then doing it, I think doing it under the direction of a physician or someone who knows is better than
Okay.
just like picking one off Amazon and doing it on your own because you can
Okay.
also injure yourself. You can get it stuck in there. You can,
Wow.
yeah, and I've
So
seen,
be careful.
like, I've
We don't
seen some
want to
stuff
just
get
be
stuck.
shoving stuff out there, you
Yeah,
know?
yeah.
Yeah.
So just be
Okay.
careful. Right?
So this says these are weights. And like I guess you what?
You sequentially will go up. You'll sequentially go up
Really? So
over
I should
time.
be using this. I've had it for a couple of years. Should I be
I mean,
using
I
it?
think it's up to you. Like if you feel like you need it, like you probably do a very good job of engaging your pelvic
Yeah.
floor. I think
Yeah.
it's really important, especially like in all of the exercises you do, like learning to engage your pelvic floor when you're doing
Mm.
lifting exercises, when
Yeah.
you're doing it's not just about like core, right? Like planking. It's about like when you're doing an RDL or when you're doing
Right.
any like even like a glute kickback, like you're engaging those deep core muscles and that actually can improve your pelvic floor more than even just doing something like that. You don't have to do the silicone or but I'm
Okay.
saying like for someone who's interested in regaining, their sex life, with when you don't use it over time, it does get narrowed. So you have to actually use something to re-expand it, and a silicone dilator is a good option.
Oh my goodness. This
It's
is
used
so
on a lot of women after, like, pelvic floor radiation or pelvic
okay.
radiation if they had endometrial cancer or breast cancer or
Okay.
ovarian cancer.
Okay, so then I'm also going to show this, and you tell me if this is a good brand. This is the local estrogen that I use. Is that
Uh-huh.
are you familiar with this?
So I Well, it's estriol plus. I'm gonna be honest with you, just because
Yeah.
I haven't seen the bottle doesn't mean it's not
Okay.
necessarily a good brand. I think
Okay.
what's really important to do is do your research on what you're using.
Okay.
There's a lot of stuff that you can get because the other thing that's really annoying is that sometimes some of these products get extremely costly. You
Yeah.
also want to be sure if you're using a compound, what's in it,
Okay.
right?
Okay.
I think that that's really important. Like, I believe a 1 gram dosage is completely necessary for it to actually make a difference.
Okay.
Yeah,
Okay. Yeah. I tried the cream at one point. I didn't like
yeah.
it. You have to
But you can do
in
tablets. You can do tablets too.
what? See,
Yeah, you can do gels.
really?
You can do
Okay.
there's like essentially something that's like a ring, almost like a diaphragm that you
Mm.
can put for 3 months.
Oh, that's what I want.
Yeah.
I don't want to. I
Yeah.
don't want to deal with putting this
Yeah.
on every day if I don't have to.
Yeah. Yeah.
Okay, that's awesome. Okay, so let's go into the next one.
Okay.
Next question. A lot about so oh, this is so I don't know. Let's see. How am I gonna say this? I'm just gonna say it. It's like we
You
hear
should.
I was
This is what I'm
talking
here
about
for.
that today. I said, this is so good because I don't think a lot of women understand.
Mhm.
We should not smell down there. Like we hear as we're growing up, oh, girls smell like tuna. No, it only smells like that if something needs to be cleaned. Like if there's an infection, something's going on. So it's kind of like I liken it to gut issues, right? Like
Yeah.
I had a stomach ache. I'm laughing about this because it's just true. But I had a stomach ache perpetually every day
Yeah.
for years and years, decades. And I was like, oh, it's just how I am. And
Mhm.
then I realized, no, it's not. There
Mhm.
is something irritating my stomach. Holy shnikes. Like the
Snaky.
world is opened up. If there's
Yeah.
any irritation, we clean it out, right?
Mhm.
Same with women. I know women who are like, oh, yeah, this is just how women smell. It is when we have something going on, right?
Mhm.
So, can you
Mhm.
talk about vaginal odor? Because this is something there were questions about. Uh, uh, what is it? Why is it there? How do we know what to do about it?
Yeah.
Uh, yeah, go ahead.
So the vagina is a organ in its own. We don't always look at it that way, but it is. And the vagina has good bacteria and bad bacteria. And at different times of the month, it can be equated to our cycles. You can have an overgrowth of the good bacteria and an overgrowth of bad bacteria. Okay.
Okay.
Um, Caveat: we don't treat bacterial vaginosis if it's not giving someone an issue. Let me explain that, okay? Because if you are having some discharge, like there's some women who are like, I always have discharge right before my cycle. I'm one of those women. Okay. And if I treat that without giving my vaginal good bacteria a chance to defend itself, I
Mm,
am killing all the good stuff in my vagina.
okay.
So I just had a client on Save a Wellness who was like, I have literally been on antibiotics or creams or something since last August. My provider has done zero cultures, but I keep telling them, hey, and when I say cultures, meaning they haven't taken a swab, and I keep telling them, well, now I think I have yeast, and now I think I have bacterial vaginosis, and I don't think I have an STD, and I've been checked for STDs, and it's not an STD, similar to kind of what your story was. And I said, when was the last time you weren't on anything? And they said, I don't know. So part of it is we will, and then here's the other thing, right? Like the industry for women has blown up. The number
Mhm.
of things you can put in your vagina is ridiculous. Besides, like, right? Like, hey,
Yes.
why don't you use Vagisil? Hey, why don't you use boric acid? Hey, use this oil because it might do this. Use refresh, use replens, use this. We have to, number one, you have to kind of get back to the basics. Like, don't put soap in your vagina,
Okay.
don't douche, go to the bathroom after intercourse,
Yeah.
try not to sit in a bath with a bunch of soap all like every day, all day. That's going to destroy your vaginal environment.
Will it?
Will a vaginal probiotic help? Maybe, but what's more important is to let your body do the work. Having said that, if
Interesting. Okay.
yeah, having said that, if you are in perimenopause or menopause,
Okay.
now your balance is off, right?
Ooh,
So
okay.
if you start noticing frequent vaginal urinary tract infections, frequent vaginal infections,
I've been
I am
there.
a big proponent for like it's time to use some vaginal estrogen
Okay.
because we need to get your environment back to adequate where you have a
Got
good
it.
pH balance. Now,
Okay.
often when women start vaginal estrogen, remember, when you start vaginal estrogen, what it's trying to do is it's trying to acidify the pH in your vagina, meaning it's very basic, and now it's trying to get acidic. You might have a yeast infection. That's fine. Stick with it. You're going to see benefit, not in 2 weeks, not in 3 weeks. When I start my patients on vaginal estrogen, I'm like, come back and see me in 2 months.
And
Two
don't do
months.
anything. Don't take anything for your
Don't
yeast
stop.
infection.
If you have a yeast infection, treat
Okay.
it, but don't
Okay.
stop your vaginal estrogen.
Got it. Okay. I see.
Yeah.
Okay. This is Alexa. Did you have the suppository things?
Are they
Oh
the
no,
Borg?
I meant like the bag to show on here. There's one in the freezer right there. I want to get your opinion on a couple things.
Okay.
There's
Yeah.
one in the freezer and then the one upstairs. So I have that you just hit on three things that I use. And I'm curious if any of this could be helpful for
Mhm.
people, or if you're saying no, you're saying look
Okay.
into vaginal estrogen. Boric acid. I actually was told after sex to use boric acid.
Mhm.
Is it good or bad? Yay or nay?
I would say you need to get tested to see what it is. Like, are you
Okay.
actually having bacterial
Well, I
vaginosis?
just mean generally after sex as a precautionary, use boric acid to clean it. No, that's not accurate.
Mhm.
It's almost like over douching, which they have a douche and then they tell you not like that's not actually good for you. Is that kind of
So
what I
when you look at guidelines for treatment with boric acid is generally used for women who have recurrent bacterial vaginosis that has been culture proven. So let me break that down. You've come to see me 3 times and you've had bacterial vaginosis 3 times in the last year. Now I'm going to look at boric acid suppositories for you. And I'm
okay.
going to do it not for a week, I'm going to do it for 30 days.
Okay.
Okay?
And
And
then not
that's when things like the clindamycin cream, Metrogel, the oral medication has all failed. Now,
okay.
if you are allergic to that or if you have sensitivity to that, can we use boric acid from the get go? Yes. My concern is using boric acid for one tab after you have intercourse. There's nothing like there's some studies that say that might work, but there's not a lot of great data. I would rather you're on like vaginal estrogen. The other thing that people
Okay.
that is so undervalued is
Yeah.
coconut oil.
Really?
Coconut oil is an antiseptic, meaning it kills bad bacteria. And you can use coconut oil like butter. Like,
These are
yeah,
coconut oil suppositories with
yeah,
good
100%.
probiotic in it.
Totally fine.
These
Totally
are
fine.
amazing. Okay.
Yep.
Cool.
That
Good to
stuff's great. Even, like, people are like so I was when I had my kids, I used coconut oil over Desitin because
okay.
coconut oil, you can so think about that. If I'm gonna put coconut oil on my baby,
Yeah.
you know
Yeah.
what I mean? Like,
Yeah.
I
Yeah.
feel comfortable with it.
Yeah.
I used to have women who have vaginal dryness who will use the estrogen, like, once they're on a regular regimen 2 to 3 times a week. They use coconut oil every single day, and they just feel so much better.
Oh my gosh. Okay. Okay. I love that. I saw someone just said they noticed a body, like an odor during perimenopause. This is normal, correct? Like
That's probably secondary to that change in that vaginal environment,
got it.
and that's when you start being like, that is a sign of perimenopause that, like, yes, you should get look, you can be on vaginal estrogen, and that will help that environment.
Okay. Another great question, impromptu, is almond oil okay for lube during sex?
Almond oil, I prefer a water-based lubricant. Almond oil will likely throw your pH off and leave you more susceptible to an infection.
Oh, good to know. Okay, so what is a water-based lubricant? What
KY,
okay.
KY. Coconut oil is totally fine.
Ooh,
Yes, you can
it
even use
smells good.
oh yeah, it smells great.
Yeah.
You can use Vaseline. I'll be honest with you, you don't have to get something fancy. Stay away from the fancy stuff. Stay
Okay.
away from stuff that, like, says it has a bunch of stuff that makes it smell good. Like, that's not what you want.
Okay,
And
okay.
then for people who have, like, I will prescribe for women, like there was the woman who wanted to have intercourse after a long time. I'm like, look, I will prescribe lidocaine gel. You can get water-based lidocaine gel,
Wow.
and in the beginning, when sex is painful, you
Yeah.
know, most of the time you have a conversation with your partner like, "Look, if we're gonna try this, I'd like to try some lidocaine gel first so we can enjoy intercourse again." Why
Okay.
not?
Good to know. Yes.
Yeah.
Okay, so a handful of people saying they had bacterial infections. Doctor put them on antibiotics. It went away, but now odor is back, but no other symptoms. They said they asked if they needed a vaginal prebiotic or probiotic. Like this is a pre and a pro. Yes.
Yeah. It's fine, but don't be surprised if it doesn't make a ton of difference
Okay.
over it's not gonna hurt you. I'm very careful with what is in, and I know you're big on this too, like clean ingredients.
For
Is it
sure.
certified clean? What's in it? What's the additive? Look at the ingredients. Like if it has like 16 ingredients, maybe not the best
Not a
one.
good thing.
Yeah.
Okay. Okay. Well, okay. So I'm going to throw this has two ingredients in it.
Yeah,
This is the
probably
thing.
coconut oil and water or coconut and glycerin, like something like that. I don't know.
Well,
But
this is that. But then this other doctor said instead of going back on antibiotics, if you feel like you have BV again,
yeah,
or you even test positive, and this is a him, this was a him doctor,
yeah.
a man, which was awesome. He directed me to
Okay.
oil. They're ozonated, hemp oil,
Okay.
ozonated suppositories. All it is hemp oil and cocoa butter. That's it. They
Yeah.
are miracles. Like
Yeah.
if anything seems to be creeping in, I use it. Gone. I've never
Yeah.
experienced anything like it.
Yeah, so I will say that again, there are lots of things. Everybody's body's gonna be a little bit different. If
Yeah.
it's working for you, that's awesome.
Okay. Okay,
Yeah,
great. Great.
yeah.
Okay. I think we already went through this. Oh, but so talking about odor and all that stuff, someone said, like, does hydration matter? The foods I eat, P.S. I shower every day.
Mhm. Um, just like our gut, there are things that will potentially like going back to ultra processed foods, going back to good healthy habits. Healthy habits are going to, like, your vaginal environment is connected to the rest of your body. So yes, like if you are prone to, like, you eat something and it gives you a stomach ache or it gives you a runny tummy or something like that, it's very possible it can impact your vaginal environment as well. So
Okay.
adding in that case, like using a probiotic is not a bad idea.
Okay. Okay. So, like, obviously stay hydrated. But
Yeah.
like, I remember back in the day, I'd read like Cosmopolitan magazine, like
Yeah.
5 foods you should eat to have your thing smell amazing, right? Like,
Yeah.
is that real? Like, can you really
No.
eat pineapple? No, it doesn't.
No.
I,
But thanks for asking.
well, it's funny because I actually do eat a lot of fruit because I'm like, I just want everything to be
And
clean.
that's fine. I mean, I think that's great. There's nothing wrong with eating the fruit. Eat the fruit. Heidi, eat the fruit.
Yeah.
But unfortunately, I don't think your vagina is going to smell like strawberries. But
Damn it.
you let me know if you eat like, it's kinda like, "Okay, guys, great one, cranberry juice." And then this myth has been dispelled, but people are like, "I feel like a UTI can't" like, I had somebody literally was like, "I had a UTI coming on, and I drank a couple glasses of cranberry juice."
Yeah.
That's what, like, their doctor told them to
Yeah.
do. Correct.
You're like,
I was like,
huh,
"You need to
good
drink
for you. Yeah.
a gallon of cranberry juice," right? Like, that myth's been dispelled, but yeah.
Well, I have found D-mannose, and I'm
Oh,
obsessed
yeah,
with D-mannose. When I
yeah,
start to feel a UTI come on, and
yeah,
sometimes I'll actually do it preventatively. I
yeah,
saw some people saying, "Yeah, I have to, immediately pee after sex." I'm the same way, but
yeah.
like D-mannose, it kind of, from what I understand, attracts the
Acidifies things,
bacteria.
yeah, and even Azo, which is over the counter, like, that's fine. You just
Okay,
gotta be careful that you're not sticking a bunch of stuff in your vagina, that's the
yeah,
truth.
I did D-mannose. I took it. Is that
Yeah,
okay?
that's
Okay, good.
fine.
Yeah.
Yeah,
Okay. So we're gonna go into hormones. Maybe we can do this speed round because we have so many questions and we've just been oh my gosh. We might have to listen, we might have to have you
2.
on again. Can we have you on again?
Yeah, we can do it again. That'd be
Oh my
fun.
gosh, I love this and I really appreciate it.
Yeah,
Let's finish the sex stuff. I'm gonna go
okay,
through the sex questions because we were already there.
yeah,
Uh, Someone says, I hate to admit this, but my sexual drive has gone down since having my baby in 2017. It
yep.
frustrates my husband because I can go days without it where he wants it. Is there a
Mhm,
way to navigate this or some way to gain that sexual drive back? I would love to know.
mhm. Um, so there are medications that are, useful, that are oral medications that you can take for low libido.
Okay.
But again, the guidelines yesterday,
Mhm.
vaginal estrogen is like Viagra for our vaginas. So it's a place to start. It's definitely a place to start. That's number one. Number two, there is a huge, I don't think I can stress this enough, psychosocial component between, like, there's literally our brain chemistry,
Wow.
the circuits are different between men and women. And
Mhm.
like, I understand your husband is frustrated and I appreciate that. That there is a psychosocial component then there. I mean, I would say like there is something to talk about there and be like, what do you need in order to get there, to get to want to have it? And how do you guys get to that same level? That's where like even the coaching comes in, where I talk to people a lot about like, does he know why you aren't feeling like you want to have it? Like that mental load, that
Mhm.
task list. Your baby is 2017, so your baby's like
Eight?
8, right?
Yeah.
Like that's a hard time.
Yeah.
You know what I mean? And so talking about it, the vaginal estrogen is huge. There is a medication. It's expensive. I don't think it's super necessary. Like if you're not in your 40s and 50s, I think that there's definitely other things that you can do. But the vaginal estrogen, I'm coming back to it. It's king. Having a discussion, like because sometimes when I have that situation, I'll ask women. I'll be like, "Can you have an orgasm yourself?" And they're like, "Yeah." I'm like, we have to think about that, right? Like if you can give
Yeah.
yourself an orgasm, but it's hard for you to have one with him, then there's a psychosocial component there.
That's I love hearing that. Two couple things I got from that. Number one, vaginal estrogen is like Viagra for women.
100%.
Remember that. I love that.
Reach.
And
Reach.
then the second thing, I've actually been through periods of my life where I feel like sex drive. Well, I will have either super high sex drive or
Yeah.
low. And the period of my life where it was low, I don't think I was able to connect until I was out of it, that it was me not being able to speak my truth. It had nothing to do with like the functionality of sex or what was being done
It's
or
mental well-being.
that's what it was, like me feeling like I couldn't communicate. So, and sometimes we think we can't communicate. So I love what you just said. You said there's something to talk about. I love that.
And feeling like comfortable and confident. I remember like when I was postpartum or even like when I was putting on weight in my late 30s
Yeah.
and I was like, I just don't like my husband would be like, but you're still sexy to me. I'm like, it doesn't matter if I'm sexy to you. I don't feel sexy to me. I don't want to
Yes.
get naked in front of myself. Right? Like that's a big component.
I love it. Okay, so here's what I think we're gonna do. We're gonna do one more sex question,
Okay.
and then we're gonna wrap up sex and vaginas today. And then
Okay.
can we do another round?
Yeah,
Can we do
absolutely.
that? Because there are so okay.
I hate feeling like I want to say, like, I know we chatted so much, and I hope that people are getting educated from this, but I love this. I love these conversations, and I love empowering women. So
I know by hearing everything that's going on,
I
I know.
feel like this is what I was put on this earth to do. Isn't that funny?
Me
So
too, talk about vaginas, but, like, actually get information from other people. But honestly, to help women feel safe and
advocate,
understood in
vulnerable.
what it like, we have this body, we're so scared to talk about it, and we're able to, you
Yeah.
know?
We can talk
Okay.
about Bruno if anyone has kids, talk about Bruno.
Yeah,
We can
exactly.
talk about vaginas, it's fine.
I love it. Okay, so the final question, you guys, and then we're gonna we'll let you share your info and all that, and
Yeah,
we'll get stuff posted, and then we'll figure out a date. Do
yeah.
not worry if your question was not answered. We will get to it next time. Okay. So this person says, I would say I have a higher sex drive than my husband. How or what would you say contributes, and how do you handle situations like that? Maybe
Mhm,
for women who are scared to ask and have the opposite.
mhm. So I have a friend who went through this, and her husband had a vasectomy, and he just had issues after his vasectomy. And so again,
Mm,
um, this is a conversation, like sitting down and being like, this is what I need. What do you need? How can I help you? Because for men, and I saw a sweet, sweet woman in her late 60s just in the last year who she's like, I just found out like he wouldn't have sex and I thought it was me. And now he got himself fixed and now he wants to have sex and now my vagina doesn't work anymore, right? Like it
yes.
happens.
Wow.
And
Yeah.
so really sitting down and saying like, I want to have sex with you.
Mm.
We want to do this. What do you need from me? How
Mm.
can I help?
Yeah.
Right? And really coming from an open, vulnerable, loving space because it sounds like you want to have an intimate relationship with your husband and you might be surprised he might want it too, or your partner, he might want it too, but he's scared. And a lot of men are scared to ask for help. They're scared to admit if they have erectile dysfunction. They think that like, oh, that she's not attracted to me anymore. Like if he doesn't know or if he doesn't feel safe to talk to you, just like you might not feel safe to talk to him.
This is, I actually love that we're ending on what we're talking about, which is communication and not being scared to say or to speak or to connect on certain things, because this is like the beginning of the conversation. It's like, hey, here we are talking about things
Yeah.
that previously and maybe historically we've all been scared to talk about, or we've been told we can't talk about.
Right.
It really does all boil down to just being open and being vulnerable and being okay with whatever is, and asking for help. So
Yeah.
I love this so much.
Asking for help. Asking for
Yeah.
help and connecting and that's what we're
Yeah.
here
Oh my gosh. I mean, this is like an hour and 15 minutes of gold.
for.
We have so much more to talk about.
Awesome.
You guys, like we will be answering your questions. Radhika, I I have so much love for you. I'm so happy I met you. I feel like we're gonna be
So
friends for life.
I do
Actually,
too. I do
I
too.
do.
I do too. We were talking about that, like these energies, and I
Yeah.
think this is what your community is about. Like you have these people with similar energies when you get into a certain state of your life, and it's beautiful, and it's cultivating, and it's growth, and
Ah, I feel the same. Well,
hey,
thank you for being on here. Okay, so real quick, just before we go, which I'm so sad to have you go, but before we go, it's SEVA, and we'll get this information. We'll
yep,
make sure everyone has it. But
yep.
what is the website again?
So it's actually Alexa's gonna, I think, post the QR code. That's the
Okay,
best
cool.
way because it's basically
Got
putting you on a way to contact, and then our people get in contact with you to see how we can match you best to whether you need a coaching call or am I the right person for you to see? Because I think that's really important too. And then I mean, follow along Instagram. I'm on Busy OB Mama. And then we talk lots of questions. We answer lots of questions. We answer listener questions. On the double scrub, we do speed rounds. So all of the
I
things,
love
and we'll
it.
keep collaborating. So
And I'll make sure that when we post something, we have your podcast, your Instagram,
yeah,
all that kind of stuff there for
absolutely.
everybody.
And I'm super like, I love talking to people. So never be afraid. If you have a weird question, like,
I love
it
that.
may take me a little bit of time, but I'll get back to you.
Oh, you're so awesome. And you should, I don't know if you can see the comments, but people are so grateful that you are here.
Oh.
This was, you guys, was this not the best conversation? I don't know. Alexa and Alyssa, has there ever been a better conversation in this community? So they said, so Alyssa right away said no. And Alexa said, it's so informational. Marley, you should listen. We're talking about female things you'll be going through in a few years. You got a wow. Thank you again so
Thank
much.
you.
I really appreciate you being here. And to everybody here watching, I love you guys so, so much. I'm going to end. Is there one final thing that you feel the community? I know we talked about doing a challenge. I think we're good. Is there one
Yeah.
final thing you think, if you like were to feel into it, what is one thing that they need to hear before you go?
Um, don't suffer in silence,
Mm,
and you're not alone.
mm.
You don't have to be alone. Don't be afraid to share your truth. Don't be afraid to be vulnerable. And it's okay if you've been like living and loving and being a certain way. It's okay to pivot. It's okay to find a different way. And that's okay.
Ah, that was perfect. I have nothing else to say.
My heart is so full. I
I
love
know,
it.
so is mine. Thank you again.